Mental health is always an important topic for Colorado as our state continues to face one of the highest youth suicide rates in the country, and advocates warn access to care may get even harder.
Proposed Medicaid cuts and funding changes may impact rural hospitals, mental health providers, and families already struggling to navigate the system.
We spoke with Congresswoman Brittany Pettersen about what's at stake and how her own family's experiences drive her work.
Ensuring that people have access to mental health care is not just a Democratic issue. This impacts everybody across the United States, across Colorado. In Colorado, we have one of the highest suicide rates in the country for our young people. It is absolutely unacceptable that we aren't supporting our kids and making sure that they have the ability to thrive in our state and get the support that they need. I'm a co-chair of a bipartisan task force where we do work together on some of these issues, that we come together to support each other's bills for substance use disorder treatment and recovery services, making sure that we're supporting access to mental health care. It's hard to even fathom what is about to happen in our state and our country. The Medicaid cuts that are going to hit us, the provider fee limitations, hospitals in rural areas, and people who aren't covered by insurance or Medicaid and showing up for uncompensated care and making sure that we actually have providers and a hospital system to support them. The entire system is set up to make it impossible to qualify for Medicaid and to stay qualified for Medicaid. So they have exemptions for people with substance use disorders, people with mental health conditions, but that is not the actual the system that they've created, because just because you exempt these populations, they still have to go through all of these hoops. They are the most vulnerable, and actually filling out the extensive paperwork requirements that they're putting in front of Americans right now. It is not about increasing access to care. It's not about reducing costs. It's about increasing paperwork and bureaucracy to kick people off care. When I think about my mom when she was struggling with her substance use disorder, having her navigate anything while she was in the midst of that disease was impossible without constant family support, ensuring that she got the help that she needed. We have a huge workforce issue when it comes to people who are going into the field for mental health support, really across our entire healthcare system. We have huge gaps in our ability to meet people's needs. We need significant investments in the infrastructure where there's healthcare deserts and lack of access. We need to be able to utilize all healthcare access to continue to be able to take appointments online and utilize that. It really helps serve people in rural communities, and we need to actually fund the treatment of behavioral health services. They should be treated and compensated like we do with physical health, and that is not the case right now. And so we are unable to actually build the capacity necessary to have a sustained system that supports people's mental health. One of the most important things that we can do is supporting our schools. Showing up at school, making sure that they have access to somebody to talk to, who's there to support them. It's also something that I'm concerned about as a mom, and I think Americans, parents across the nation feel the same way. What our kids are watching, the ways that they're being targeted with algorithms, how social media has impacted their mental health, and what we can do to protect them. I talk a lot about, my mom struggles with a substance use disorder and what I saw in our broken system fighting to save her life. But I've also, unfortunately, seen the devastating impacts of my older brother, who fell through the cracks and wasn't diagnosed and I didn't have access to health care and struggled financially, and we lost him to suicide. I think it's really important that we reduce the stigma and tell our stories, because that's how we bring an understanding to what's happening and what we need to change. What's really important is that we increase access and we make it easy for families and for kids to get the services that they need, and the best place that we can do that is at school. When I think about how critical my school was to saving my life and making sure I didn't go down the path and follow my mom and the struggles that she faced, it was my teachers that believed in me and my counselors that were there to support me. My personal experience drives my priorities in Congress and in addressing the barriers that people face. Having a mom who struggled with a substance use disorder for decades and seeing how broken our system was and the lack of access to the treatment that she desperately needed, on top of having a brother who struggled with mental health issues and ultimately fell through the cracks and died from suicide, it informs the empathy that I have for people, the lack of judgment that I have for people, knowing that substance use disorders are a disease, that it demands medical treatment. This is a unique opportunity to remind people about what we did provide, why it's so important, how do we rebuild in a way that actually supports people and addresses the constant feeling that they're being left behind. The greatest power that we have is reducing the stigma around those who are struggling with a mental health issue and talking about how critical the services are that are being taken away.
Pettersen says behavioral health must be treated like physical health, with stronger school-based support, workforce investment, and fewer barriers to care.
And we want to let you know that if you or someone you know needs help, you can call or text 988 for Colorado's free 24-hour crisis line.